Essential tremor is a progressive tremor disorder that usually runs in families. It's not a lethal disorder, but it's a very debilitating problem. What it basically looks like is patients have tremor when they reach for something or try to drink from a cup or write. Over time, the tremor gets worse. Usually it's very responsive to medications, at least initially. Any patient who's diagnosed with essential tremor undergoes medical treatment first. Typically that's done either by a neurologist or a primary care doctor. There are two medications that are commonly utilized. One is propranolol and the other is primidone. Sometimes those medications are enough to control the tremor and improve the patient's quality of life. However, if those medications fail to control the tremor, there are surgical options such as deep brain stimulation or focused ultrasound. To be a good candidate for focused ultrasound, you need to have an established diagnosis of essential tremor. You need to have failed medication treatment for the essential tremor. The tremors have to be debilitating and affect your quality of life and your ability to carry out your activities of daily living. You have to be able to undergo an MRI. You have to be able to undergo a procedure that lasts about 3 hours awake. And then finally, you have to pass a screening scan that we obtain after seeing you in clinic if you're a good candidate. So functional neurosurgery is a branch of neurosurgery that basically encompasses the treatment of medically refractory movement disorders such as essential tremor and Parkinson's disease, the surgical treatment of medically refractory epilepsy, and also the surgical treatment of medically refractory pain disorders utilizing neuromodulation. So there are a variety of surgeries that are performed for epilepsy. The decision as far as what is the best surgery for the patient is very case dependent, and those decisions are made by a consensus group here at OU. But briefly, the variety of surgical options we offer here include open resections, laser interstitial thermal therapy, otherwise known as LIT, stereo EEG, invasive EEG monitoring such as subdural grids, responsive neurostimulation, otherwise known as RNS or NeuroPace, vagal nerve stimulation, otherwise known as VNS, and also deep brain stimulation, also known as DBS.